in agenda, we have very important topic, the science of longevity, the old and new biomarkers of aging, and how long we live depends not only on our genes, but several studies have shown that there are epigenetic mechanisms that can repair DNA damage, increase longevity, and reduce the risk of disease. To give us more information regarding the same, I would like to call upon our next speaker, Dr. Samantha Tulla. Can we have a round of applause? Come on, everybody. Let's give it up for Dr. Tulla.
Thank you, everyone. Thank you for coming on time and waiting for me, couple of you. So let's give it a minute or two till others come in, and let me give you a brief story, because I think we should all come out of this lunch somnolence. But since the food was more low GI, I don't think many of you are sleepy yet. So I'm a MD internal medicine doctor, passed out like every other postgraduate, then had a kid, gained around 20 kgs of weight, was very inflammatory, having severe headaches every other week, was working as assistant professor as a medical college, coming with a headache back home, not feeling very active to play with my kids, feeling very tired, trying to find reasons why I'm feeling tired all the time, not able to have that energy which I should be having when I was at the age of 29 and 30. Then I was trying to figure out there's something to do about with the food that I've been eating throughout my pregnancy, where I was on steroid, like gained nearly 25 to 30 kgs of weight during my pregnancy. What went wrong? Trying to figure out, I found out there's something called glucose variability, which we were not taught during our MDs. We were just taught about the average glucose over a 3-month period, or post-lunch glucose or fasting glucose, but pretty much that's it. Then we learned about glucose variability and figured out that is what has been going wrong. Then changed my diet, kind of lost my weight, feeling very energetic. Coming back home, then I realized I was happy, healthier. I could affect many more lives. I thought this is not the place where I have to be. I was doing medical oncology during that time. Then I left the course thinking sick care is not my area. I want to be in the preventive care and the health care. I want to create health, which is not taught during post-graduation, sadly, when we were becoming postgraduates. We were taught to treat disease, but not to create health. Yes, in our passion towards creating health, here we are today, learning about functional medicine, longevity medicine, and how to track, what to do, how to improve, how to get better of ourselves, how to become the best version of ourselves. Since we have previous speakers here, when they were doing their research to determine NAD levels, to determine this biomarker, it should be measurable, predictable, specific, and more sensitive. That means you should be able to do it consistently in many people, and it should not be a causality or consequence, but it should be a causative factor. And it should not be changing with things like walking, changing lifestyle, or stressing. That's why biomarkers are very specific. Not every other thing that changes or is variable is a biomarker. Yes, BOLD score is a very good predictive marker for your cardiorespiratory fitness. The longer you're able to hold your breath, the better your cardiovascular fitness is. But what is more specific than that? Since Dr. Visalam is very actively participating, if not BOLD score, what else? Let's move the slides, and then we'll find an answer in one of the slides. So let's start with the multiomics, starting from genetics. We have many speakers today who were speaking about how genetics could determine everything. Like you're obese, it's determined from your birth. If you're in a certain weight, it's already determined. But do you all think so? No? 10 to 15%, yes. Rare genetic diseases, yes. But rest of the time, people are creating history. People are sharing their stories. They're reversing their biological ages. They're losing their weight. They're becoming metabolically fitter. People are becoming 10 years younger. They're redesigning their story. That is because of the epigenetics. The changes that we can make around genes today with just hacks, simple hacks, sleep, circadian rhythm, exercise, supplements, and many more, can change the way the genes behave. It's turned on or off, it's on us. Yes, it's a loaded gun, but it's up to us if we want to trigger it or not. That's where genetics plays a role. Coming to epigenetics, there are a lot of things that are happening. There are a lot of genetic DNA modifications that happen. There are different names given to it, methylation, histoneacetylation. Depending on what kind of change we are trying to test, That is how a clock is determined. The most famous one, which most of us follow and have been using, is Horvath clock, which is dependent on DNA methylation. It gives us an estimate as to what your biological age could be. But do you get any more insights beyond that? I mean, no. We know, okay, we'll get our baseline though. If I'm at so and so age and my test is so and so, it gives me a push if I want to get better in next down the line in 1 year or 2 years. Where am I compared to what I was previously? And what all alterations I'm going to do going further? It is definitely a baseline. It is a additional tool. They're all our buddies that we take with us and go forward, but it is not yet, it's not going to give a specific insight into what exactly we can change. So that is where epigenetics plays a role. And next comes to metabolomics. So let me give you some case scenarios. Let me talk about myself. When I got my metabolic profile done, I want to look at how my carbs, my fats, my proteins are being metabolized. That means what products are left over after the metabolism in my urine, in my blood. Those are the markers which will determine what is left out, what are the substrate being utilized. And later I found out my fatty acid oxidation is not going on well because of L-carnitine deficiency. Simple thing, I changed. I tried to include more L-carnitine. I had to supplement it because I was not eating a very diverse food. I felt better when I was taking fats. Glucose also, I had a little problem. I started taking more chromium. Things started changing for me. And gut dysbiosis, I think 70 to 80% of the people today, healthy looking, good skin, sitting very vibrantly, also have gut dysbiosis, unfortunately. It's because of the diminishing diversity. As such, the diversity diminishes because of the number of lifestyle factors that we all have today, the lifestyle habits, the altered circadian rhythms, and the kind of diet we eat. Not varied foods in our diet, very restrictive, very few foods for lunch, very few foods for dinner. That is how we were culturally trained sometimes. But in the course, we also started losing few foods, and now those come into play as these are the very rarely available organic foods. That is not rarely available. We made them very rare by not utilizing it. So that's how microbiome diversity was becoming less diverse, I would say. And that was gut dysbiosis. And along with that, one of the talks was majorly Dr. Patana was talking about PPIs, why we shouldn't go with PPIs. What is happening with all the acidity which is not being corrected but improperly overcorrected by using proton pump inhibitors and so all sorts of things, and not efficient digestive enzymes, either because of the less consumption of the fruits that we all have to take, not taking enough, we all land up with gut dysbiosis. But coming to age as a factor, naturally as well, microbiota diversity decreases, not just the diversity. There will be variation in the phyla as well. If you have heard about bacteroids, firmicutives, actinobacteria, and things like this, we have a certain balance when we were born with. But with regard to our changes around us, lifestyle and everything, we're changing the ratios of it. Nowadays, we see everybody is on a higher side of firmicutes and lowering bacteroids. Why is it happening? One, aging also has a consequence of this, and how we support it also matters. What kind of foods, what kind of prebiotic fiber we are giving them also does matter. That is where microbiota is playing a role, and I still feel microbiota target is very important. Genetics 10%, epigenetics 5 to 10%, but microbiota profile, microbiomics as such, has got a little better role or more role than that. Metabolomics, more than that, of 40%, 50%, more than that. And now coming to proteomics. Proteomics also plays a very similar role in the sense that what is happening as we age? What are the proteomic molecules that are dysregulated as we age? And are we able to catch it through the tests? Tests are not available in India. And also, I don't think many of them are doing pretty much on proteomics. I want to listen to you later after my talk if there is anything else going on. And after that comes the clocks. People are coming up with different aging clocks by the sense that every organ ages at a different pace. Why is it happening? Every organ has got its specific biomarker. If you look at liver, the specific biomarker will be albumin. If you look at kidney, the specific one would be cystatin C. And also in liver, there are transferases. If you look at sugar balance, of course, HbA1c, and now more importantly is glucose variability. And now apart from that, functional decline. Let's talk about, now we have gone in depth about genetics, epigenetics, microbiomics, metabolomics. Where are we standing today in terms of functional decline? Do you know a person at the age of 80 has 50% decline in his vital capacity, in the sense how he utilizes oxygen in his lungs? It becomes half from the time he has been at 40. Such drastic difference. So today, at the age of 40, if your more cardiovascular fitness is there, if you are able to, your VO2 max is higher, then you're better at 80 when compared to your peers. But at the age of 40, if you're starting off low, then imagine you're half of what you are now. So all the chance that you have now, if you're in your 40s or in your 50s, it's time for you to increase your VO2 max, your vital capacity of the lungs. That is about the lungs that I'm talking about. What can we do in terms of vascular health? See, it's too late to do a ECG. Changes are there. Pretty much things have gone wrong. You're doing a stress test or a treadmill test. You just want to show people are a failure because you're not, you're positive. That means you have not passed out stress test. You're late. What can we do even before we arrive at a stress test? So there is something called diabetes risk profiler. People have considered that should be used only for people who have diabetic complications because they think only diabetes people can have cardiovascular complications, which is a very wrong notion. Even before we end up developing high blood pressure, cardiovascular diseases, even before high blood pressure happens, other things are already happening at a vascular level. We are developing vascular inflammation, also, we are developing mitochondrial dysfunction. So, here at this stage, what can we do? Have you heard about intima media thickness? There are 3 layers in the vessel wall. We can check for intima media thickness. We can check for pulse wave velocity. If we can catch hold of things going wrong there, we can have many more years ahead of us. And it's a simple device, simple non-invasive device, sold on the name of diabetes risk profiler, cardiac risk profiler, but it is a simple health risk profiler. It's time we all start using that and take out from that arena of diabetic complications. So, outside that, what are the functional declines can we see? We have seen kidneys function is going down. We're trying to assess it with cystatin C. Vascular function is going bad. We're trying to assess it with intima media thickness and also with pulse wave velocity. For lungs, we're trying to witness how your VO2 max is, how your capacity to utilize oxygen has been changing. And what else is happening? Cognition, memory are going wrong. So that's where preventive brain health strategies have come into play now. Starting from simple foods to supplements to biohacking at the level of HBOT and things like that, where you want to reduce oxidative stress in the brain, improve your mitochondrial function, improve more microvascular circulation, exercise, all these things come into play as well. Apart from this cognition, the nerve wave velocity, the electric impulse, the passing speed reduces as we age. And do you know at what rate? It falls down by more than 60% between the ages of 30 to 80. That means we will be declined by 70% more. That is why now we talk more about brain health. We talk more about supplements like omega 3 fatty acids. We talk more about healthy fats that we need to be having, like olive oil, olives, and avocado, and nuts, seeds, and whole grains as well. So the nerve conduction studies again was only done in people came complaining with tingling in the nerves and numbing sensation where things have already gone wrong. You can just say it's abnormal. You have already wrong. You just want to test the patient and show that his impulses are not conducting. But that is already time has passed. So it's time we use certain diagnostic devices which are used in diagnostics, pull them away and put them in screening. We can do a lot better job. Same comes with hearing. Why do we have to do a hearing test when a person has already complaining, I have hearing loss? That is when they start doing audiometry. That is when they start doing hearing test. But let it become a part of the screening protocol. Very, very, very important. And also, we see retina scanning only done in people who are already diagnosed with diabetes, hypertension. It should become a normal thing. Sometimes we catch hold of hypertension just by looking at the retina in the eyes by microvascular aberrations and all. So, things which are smartly used to diagnose complications are nothing but a screening tool because we are able to detect all the functional decline which happens much before years before the metabolic decline already happens. And not just that, how many of you check hand grip at home? How many of you have a dynamometer at home, or for your parents, or it's 200 rupees to 400 rupees maybe? It's available on any marketplace. I think each one of us at home should have one. Um, do, so it's a hand grip. Hand grip indicates the muscular strength, which is again, muscle is important for longevity. Maintaining muscular strength and bone mineral density are very important. Before, they thought it was a consequence. Oh, you're aging? Muscular decline is a normal thing. Oh, you're aging? You're prone to have osteoporosis. But we can prevent that. We can improve things by just building strength training into your routine. Both my parents started strength training since 2 years now. With a trainer who can help them with the body weight training, resistant band training, they're doing much better. They started complaining less. To have parents in the family who are frequently complaining 2 years before to now will give you a lot of information. That means, and not just that, my father who is hypertensive, diabetic, dyslipidemia, everything, but things have come under control. His sugars are pretty much balanced now. I told him 3 strategies. De-stress yourself the night before you sleep, have good night's sleep, wake up, look at the sunrise, optimize your circadian rhythm, eat enough protein, and strength train. This is a cycle he has to follow. He started following one thing at a time. Including all 5 things is a task to our parents who are multitasking. And it's impossible for a doctor child to tell them. And they're difficult patients as well. So I think one thing at a time will do a lot of change. So these are the functional declining that happens as a causal factor, but how we can screen in terms of multiple areas, multiple organ systems, like how we talked about nerves, eyes, hearing, liver, lung, kidney. These are the 6, and brain. These are the 7 to 8 areas where functional decline happens and how we can track of it and how we can prevent it. When it comes to skin, age reader, the Singapore age reader where we put the arm on and it picks up the oxidative stress from the skin and determines your skin age. It's a skin aging clock. Some detect by facial images. It will look at the wrinkles and changes that happen over the skin and will determine skin age, facial age. And this skin reader, which is called age reader, non-invasive again, it will look at what your oxidative stress is. Similar to that, there is something called oligoscan. It's a reader which detects the heavy metals, where it picks up photometry from the reflection of the light, which is coming from the oligoscan, and it will detect how your oxidative stress levels are. Usually, if you have to check oxidative stress, we can't do a blood test of OH, 8-OHBG and things like that to check oxidative stress. But they figured out a non-invasive way. But this is not yet FDA cleared. Anything which is more useful is not easily FDA approved. So that is a known fact. So it won't be FDA approved for going a few years. Same like how NAD has been removed from over-the-counter nutraceuticals as well. So when it comes to, yeah, that is about functional decline and how you can detect these biomarkers, some non-invasive and some minimally invasive, and some blood biomarkers, and some are at a scanning level. And what about wearables? There's some fantastic indicators in the wearables that we are using today. One of them is VO2 max, which is not matchable to the proper VO2 tests that we may be doing outside, because it again depends. Variability factor is there, so VO2 max. But there are some comparative studies which are done by few people between VO2 Master, one of the VO2 testing machines, with Apple Watch. There was only 1 to 2% difference between both, between Apple Watch and that. So I think that is pretty good. From then, after reading that study, I started seeing my VO2 max very regularly on the watch. Next is heart rate variability, very, very important. Resting heart rate is important. Most of the time, it's important that it is on the lower level. But how often do we check it? It's important that we are not just wearing a watch, but utilizing these 4 to 5 things from the wearables that we use today. So, heart rate variability, resting heart rate, VO2 max, and an ECG is not a screening, is not a diagnostic. It comes under nothing. ECG is there just for um, already existing atrial fibrillation patient, already sensing a palpitation, then he wants to detect. It's too late by then. But it's a wonderful feature for patients who are already having atrial fibrillation. And now, barring all that, we have moved non-invasive, invasive, blood markers, screening, scanning, wearables. Now, in wearables, there are 2 to 3 more things that have been challenging last 2 to 3 years. I think most of us must have already worn a CGM. How many of you have been wearing a CGM or worn a CGM? How much did it help you? I want to hear from you, your perspective.
Yes, and yes, but lucky me and myself, I'm very low glucose level naturally, but it gives a lot of information. I'm pretty surprised typically when I eat a banana in the morning, it's a huge increase, and clearly it was really then actionable. And
Yes.
regard to the type of food, and especially it eats more first proteins, then fat, then more carbohydrates, just about these kind of things, basic things, but I think it's very,
It's
very
very great,
valuable.
insightful, you would
Really
say.
insightful, yes.
How many days do you think, as a high performance person, do you think you need to wear a CGM?
Yeah.
For you, at least.
Yes, that's. I tested so many things in my life and all these variables, and the way I see it, it's just to learn from my body, but it's not something that I will wear actually over a long period. So for me, CGM it was maybe 1 month, and gave a
Yes.
lot of insights. And after I stopped because I don't want to be dependent on these kind of things. Yes.
Thank you. This is very insightful. How much do we use technology around us is very, very crucial. Do we have to use it long time? Do we have to just use it as a supporting tool? We should know how smartly we need to use it. People sell, take 12 boxes, you can use it for 3 months. Yes, but don't fall for that. All you need is to first 15 days to experiment, next 15 days to understand. If you want to start applying, maybe a 15 days more. But if you're already a pro in the first 4 weeks, you don't need it. That is what few of our experiences also have been. It was wonderful. Thank you for sharing. We wanted to hear what other inputs also have been. And who is wearing a sleep ring or an aura ring? I want to hear from them. Darshit, what is your experience on it?
No, it has been definitely good. I've only started wearing it for a past couple of months. So I definitely thought that I was losing out the exact reason why I'm not able to sleep properly or not able to wake up with that kind of freshness which I do on the other days. So I slowly started looking at a little habits that I had before sleeping. For example, screen time. When exactly do I leave a screen and sleep, and see how much of that gap is? How is it affecting my sleep? What's affecting my HRV during the sleep? So I think some of these factors definitely come into play. Also, one of the instant gratification I got from my ring was that every morning it shows me a readiness score.
Okay.
That pretty much inspires me. Oh, I'm 85 and above. Today I'm going to work an hour extra.
Same
So,
thing with the CGM as well. How wonderful is it to see your metabolic score over 95, 96, 98, sometimes hitting 99 and 100. There were days when I reached 100 and I felt it's enough. I think I have mastered CGM and I'm not going to wear it again. I thought I was biohacking it. I don't know what I was doing. I put it on the other arm. I removed the sensor. I didn't wait for 14 days. All the 4 days it was 100. Then I started wearing on other arm. Then I started noticing it was 9900 as well. I don't know if I mastered it or it mastered me. Like, it's nice to learn from things because I could figure out I was doing things well and in right timings, right proportions of the food, and stress you're managing well, sleeping on the right time. If you've mastered all these 4 to 5 categories, I think it's time you leave the device and not be dependent on it. That is what you're trying to say, I think. That is very true. And what is that device? Maybe probably you need it for long term. CGM maybe it's not long term, but it will help you guide. It will help you keep you in track. It will help you progress. And I don't know. I've never wore a sleep ring. I felt if I wear too many devices, I would be distracted to look at the phone. Where am I? That will add maybe more stress. So I never worn it. But when time comes when I stop falling asleep, maybe then I'll wear it. So, yeah, but these are all habit making. If you want to make a new habit, if you want to develop a new habit, if you want to tweak your routine, these are wonderful devices. Use it smartly. I think it's time for doctors like us to start using AI. If we don't use it AI today, it is going to replace the doctors who don't use AI. Otherwise, it's not going to replace you. You should use AI smartly as well. Because most of my patients who wear all these kinds of devices share data. Samantha, tell me what's going. All my friends share data, and they'll be like, Samantha, check my CGM values over the past 10 days. Tell me what is going wrong. Certain periods of the time it's showing high. My metabolic score was low on certain day. I was like, I need to sit with you. I need to find out what you have been doing every hour of the day. So that is some insight which I wanted to give you. I think it is more self-learning. Initial days you may need some assistance, but it's self-learning later. So if you look at it, wearables is now being used as a new term, wearabelomics. It's where how you integrate this data onto whatever data you've got from your blood markers, what you got from your metabolic score, metabolic tests. Functionally, how are you? How is your efficiency in terms of your lungs, kidneys, liver? And when it comes to, apart from cognition, frailty index as you age is very important. How is the coordination? How is the balance? Are you dependent on any external things to maintain stability? All these things do come into play. So when there is an elderly person walking into my clinic, we do a frailty test. And then after 3 months, after we train them, give some form of strength training exercises and physiotherapy and give certain things which are needed according to their age and problems. Then we retest the frailty index, retest their cognition with mini mental score examination, which is the scoring non-invasive test that we do for cognition. We need to apply all these in terms of clinical scenarios as well. How we include all these will actually make sense. How early you include them into a person's clinical scenario also will add a lot of value. We get a lot of data. I have this patient who walked in with high BMI. Again, BMI should not be considered appropriate biomarkers because most of the people who have good muscle mass also have high BMI. So waist to hip ratio of this 40-year-old female was high. She has fibromyalgia, have aches and pains all over the body, insomnia, not able to sleep, pre-diabetes, dyslipidemia. Her goals are to lose weight, not have pain anymore, have better sleep, things like this. When it comes to her exercise, she rarely exercises. She doesn't believe in taking any kinds of pills. Oh no, I'm very natural. She's dependent on diet. She doesn't pop any pill. She was previously mildly hypertensive. Doctor put her on antihypertensive. She didn't take it. She's against pills. She has a big family, a lot of stresses in the family. She doesn't sleep well, a lot of pains, which also makes her sleep a concern. We could see her cognition was not very good. Sugars are all over the place. Though she was pre-diabetes, her sugar glycemic variability was all over the place. Sleep not good. We didn't need a ring. She could write down in a book and tell me which days she didn't sleep, and most of the days she didn't sleep well. And here is the goals. She wanted to lose weight and all. We put her on low GI index food, added supplements according to her age, according to her metabolic profile, what she needed, what is she lacking. Also add up hyperbaric oxygen therapy for her to get better sleep and better microvascular circulation improvement and all those things. And gave her a few IV therapies because she was also nutrient deficient as well, and some physio strength training. 4-5 months later, she started sleeping better, lost some weight, more active, able to take the stress better. It's not her stress has gone. Feeling light, less body pains. She's off her tricyclic antidepressants that she was taking before because of the sleep and fibromyalgia, which her neurophysician was put on. She's off on all that, and she's on vitamin D, omega-3, L-carnitine, and she's on NMN. And she was also, her TSH was little towards higher side, but her antibodies were negative. She needed little selenium, little iodine, and things were going in a right direction. So this is how relevant biomarkers can be, how we can utilize to bring small changes at a time. 3 to 4 months is good time to show progress, and then comes the determination to improve much better. And there is hope to improve, because by the time she's in hospital, she's already lost hope. Oh, you're diagnosed with fibromyalgia, I have to put her on TCAs, you're going to have this pain. The more discouraged person has become better. I think creating health, I felt, is more better than just treating a sick patient. Thank you.